What is, can you say what is your name, where you work, in which country, and in one sentence, what is your involvement in community health?
Okay, thank you very much. So my name is Dr. Robert Akparibo, and I work at the University of Sheffield as a senior lecturer or associate professor in global health and nutrition. That is in the United Kingdom. Before I went into academia, I started my career as a development practitioner, working in Ghana, but I have also worked across West Africa, where I led the implementation of community health interventions, and the aim was to improve the health of local rural communities. Mm-hmm. So based on that, my research is largely based on the work that I've done in the past. So I'm currently a researcher, and my interest is around global health and nutrition in low middle income countries.
Okay. And how is community health organized in your country? For example, is it well visible? Is it well funded? Are people trained in community health?
So let me just give a general structure of the Ghana health system briefly before I talk about how community health is organized. So the Ghanaian health system is organized into 5 levels of providers. You have the health post, which is now called the CHIPS compound. So I'll talk about CHIPS a little bit later. Mm-hmm. So this is the first point of primary care in rural areas. And then you also have the health centers. So people go to the health post first at the rural areas, and then they may be referred to health centers and then polyclinics. And then you have the district hospitals, then the regional hospitals, and then tertiary hospitals, which is the teaching hospitals. So this is how the healthcare system is structured. Now, in terms of community health is organized in through various strategies and programs. And the aim is to improve the health and well-being of the population more generally. So there are a number of strategies that community health operates. So I mentioned the CHIPS. So first is the CHIPS, which is a flagship community health strategy. And CHIPS largely focuses on bringing healthcare services to very close to the rural population. So instead of people going to access healthcare, the healthcare is sent to them at the local level. Okay, so under the CHIPS strategy, you have community health officers or community health nurses deployed to provide primary healthcare services within the specific catchment areas in the rural areas. Okay, so these health workers then engage with the community members. Then they conduct health education sessions, provide basic health treatments, and make referrals where necessary. So they work at the CHIPS compound, which is CHIPS basically mean community health planning and services. Okay, yep. So they then refer people to maybe polyclinics where they cannot handle. Some of the conditions that they cannot handle. So that's the first strategy that works well in Ghana. Now, the second strategy is the involvement of communities themselves. So call them community health volunteers. So community health volunteers kind of extend the reach of healthcare services. So that's, as you know, there are problems or challenges with the capacity of health workers to deliver health across the country. So community health workers are trained. They are identified within their own communities and are trained to provide or work closely with the community health officers and nurses to provide that public health services to the rural people in their own communities. So they assist in delivering health education messages. They conduct screening and facilitate the referral. So sometimes when they refer someone and they are unable to go, the community health volunteers may be able to assist them or lead them to the referral center. So this is a strategy that is very important in mobilizing and strengthening health seeking in the country.
Yeah.
Now, the third level, the third strategy that works well in the country is we have what we call the community health committees. So these committees are community-based organizations. So we call them community-based organizations, and they are responsible for overseeing and supporting community health activities. So these committees comprise community members who volunteer their time and expertise. Of course, I mean, they are given some training and incentives. So they work very closely with the health workers to organize and deliver health campaigns, mobilize community resources, and also advocate for the health needs of the community. So they play a vital role in promoting community participation and ownership of community health programs. And then the fourth strategy is the introduction of the national health insurance. So the national health insurance aims to provide financial protection and access to healthcare services for all residents in the country. So it operates at the community level also, with community health nurses and community health officers playing a role in enrolling people into the scheme, but also providing education, health insurance education to the people. So they need to know why they need to have health insurance. So the health insurance help ensure that community members have access to affordable health services and can receive necessary treatment without financial barriers. So before the health insurance, people were paying healthcare out of pocket, and that was really not helpful given the financial situation of many Ghanaians. So the last but one strategy is involvement of non-governmental organizations in the country. So non-governmental organizations work within the reach of areas where government health services do not reach. Of course, they also work in areas where the government services reach, but that is in collaboration with the government health institutions. So these organizations offer partnership with the government and other stakeholders to implement health programs targeting specific communities or health issues. So NGOs may focus on areas, for example, like maternal and child health or HIV prevention, but they also kind of do activities like water and sanitation education and so forth and so on.
Yeah.
So the last bit is what we call the district health management team. So the health is organized into a management team called district health management, and this happens within the district level. And they are responsible for coordinating, overseeing healthcare delivery at the district level. So they work closely with the community health workers that are there working in the health compounds, the community health planning compounds, and other stakeholders to provide preventive healthcare. So that is how the community health is organized. Now, whether it is funded, well funded, so that is a very big question, because there's no country that can say that their health system is well funded. But of course, within Ghana, the government has tried to kind of introduce this health insurance where, people who otherwise would not be able to access healthcare because of the cost are able to do so because of the national health insurance. But there are teething problems with the national health insurance scheme. But of course, it exists and it helps with the healthcare delivery in rural areas and, of course, in urban areas too.
Yeah. Okay, thank you very much. I will move to my second question. What have you learned in the past few years about community health, specifically about stakeholder engagement and mobilization of the community?
Yeah, so thank you. Like I said, I mean, because of the strategies that are put in place involving communities themselves in delivering of healthcare, that has really worked very well because without the community volunteers, I mean, uptake of health services would have been very poor. But because you involve community health volunteers, they are able to mobilize the community's members to even support with healthcare delivery. And so they take ownership of that, okay? And then the second one is what I talked about. I mean, where NGOs are involved. So there are so many NGOs in Ghana, NGOs, UK-based NGOs, US-based NGOs, Netherlands, Dutch-based NGOs. So they are a plethora of NGOs that are based in Ghana, and they have been working very, very closely with government to deliver healthcare to the people, especially in areas where government health services do not reach. So we call these areas hard to reach areas.
Yep.
So that is something that has really worked.
Great. That's gone wonderful. Thank you very much. What role can community health play in improving population health and well-being?
Well, I think we can look at it in different layers. One is preventive care. So you have community health initiatives that focuses on prevention or preventive care by promoting healthy lives, healthy behaviors, or healthy behaviors and lifestyle. So, you know, let me just go back to the community health volunteer scheme where you deploy them to support health workers to kind of go to the communities and raise awareness about the importance of regular exercises, balanced nutrition, or if you like, good nutrition. They mobilize communities for immunization and screening, even screening for health conditions. So that is one role that community health plays. So preventive care. The other role that community health play is access to healthcare. So again, community health programs strives to ensure equitable access to healthcare. So it cuts across, I mean, all regions. So community health helps address barriers such as geographical distances, affordability, cultural beliefs, and language barriers. So, and by improving access to primary care, preventive services, and things like specialized care when needed. So community health initiatives can enhance overall population health through these. So access to healthcare is another. Now, I can talk about health education, which is also tied to what I said earlier, preventive care, and then partnership and collaboration. So community health effort involve collaboration among various stakeholders, including healthcare providers. It could be clinical healthcare providers or public healthcare providers, community organizations, and even government agencies and educational institutions. All these partnership helps to ensure ownership, expand scope of the healthcare, and then access.
Great. Well, finally, Robert, as an experienced professional, what advice can you give to the new generation of community health workers?
I would say that community health, delivering community health within the local communities is very rewarding. It can be challenging, but it's very rewarding. And I can give myself as an example that some of us were able to be offered financial support to undertake further studies because of the kind of work that we did in rural areas. Because, I mean, when I wanted to study abroad and I did my application, so these were some of the experiences I drew in my application to say how I am helping local communities improve their health. And I'm very sure that kind of caught the eyes of the reviewers of my applications to offer me that scholarship. Okay. So even if the political leaders will not see what you are doing and value what you are doing, someone elsewhere is looking at you. So that is the advice I would give. So if you find yourself working in community health, you need to do your best to do the right thing and actually work well and just pray that something good comes your way.
Thank you very much.
Yeah, thank you.